So it's quite remarkable that as children grow into young adulthood, there are phases in their lives. And these phases in their lives have different risks associated with those phases. So interestingly, puberty is like a natural disease reset time. So if a child has been predisposed to having a certain risk, by the time the child gets to puberty and comes out of puberty, it's almost like restoring the child back to factory setting. So in that sense, the child is able to recover from the problems that might have maybe started in childhood. So adolescence is a time whereby there is no reset anymore. After adolescence, you go into young adulthood, then everything else can happen without any reset. So which makes adolescence a critical time point. And that is what we found out from this study, that if we look at the cumulative effect of fat mass from childhood to young adulthood, it apparently appears not to have a significant effect on the heart. But when we look at only this phase after puberty, the little increase in fat mass within that period was dangerous to the heart. It could affect the heart adversely. So we have studied, or we have published some papers earlier where we found out that the post-puberty, towards the age of late teenage years, are the most critical time point when fat mass insulin resistance vicious cycle begins, when it is impossible to reverse the problem of cholesterol level and its effect on the heart as atherosclerosis. We have also discovered that it is a critical time point whereby arterial stiffness might cause things like metabolic syndrome. So this age, late adolescence to young adulthood, is very critical. It is, we can say it is the point whereby physiology deviates into pathology. And if that is the case, then that is the point we need to focus on. We should also understand that probably maybe in the Western world, that is also the time when adolescents become independent of their family. So they start living alone and they start changing their diet, their physical activity levels changes, they start having peers, they start maybe smoking and doing all kinds of things. So it's a very interesting time point in their lives. But also it's time point that is very strategic in setting up a disease process in people who were otherwise normal when they were young. Well, it is not only hormone changes that explains that result. One of the explanations of the result is the volume of muscle mass. So muscle mass is protective of any damage in the heart. So in childhood, the ratio of muscle mass is 4:1. So the ratio of muscle mass to fat mass is 4:1. So because of that effect, fat mass do not really have sufficient power to damage the heart. But when you come to adolescence, the ratio drops to 3:1. So 3 times more muscle mass than fat mass. Now, that simple reduction means that fat mass now has more power. So in that regard, the effect or the troublesome effect of fat mass now begin to start showing. Even though it may look like, well, it really doesn't matter, it's very small, but it is a progression because disease does not happen in a day. It's an accumulation of so many years. But we can easily find that slight deviation. You know, if somebody is traveling and you just leave the road just narrowly like this, after a while, you become so far apart. So that's what happens at the teenage years that we have discovered. So there is a reduction of muscle mass as we grow, which is natural, but that is when fat mass begins to exert its negative effect on the body. So we have discovered that fat mass in the trunk, visceral fat, is worse than fat mass in the entire body. And to be able to assess fat mass in the trunk, we have different measures. So we think that not everybody will be able to access very expensive devices like DEXA measure of fat mass and so on and so forth. But we can be able to have a waist to height ratio, which we have discovered is very close to a direct measure of fat mass. So with a waist to height ratio measuring tape, It doesn't matter your ethnic group, whether you are Asian or from Latin America. You can be the waist to height ratio is able to detect fat mass in everybody, both in young and in old, almost similarly. So the variation is very simple. So what happens is that waist to height ratio detects both total body fat as well as central fat. But interestingly, now that we have discovered that tool, what we need now to do is to apply it, because visceral fat or truncal fat has a worse effect on the metabolic profile of either children or adults. So what we need to do is to measure children early, and we have established a cut point, because we have related this waist to height ratio cut point of above 0.5 in boys to predicting the risk of type 2 diabetes, liver fat, and then some people have used it to predict heart failure and bone fracture. So these are very important information that this tool can give to us. And these are components of metabolic syndrome. So you have problem with cholesterol, glucose level, high blood pressure, and so on and so forth. So we can use the waist to height ratio as a small, cheap, universal tool that can be used to detect children at risk of cardiometabolic disease, because it really estimates fat mass in a very affordable way. Yes. Thank you very much.